Hi, Assalamualaikum. In this video, we will explaining a genetic disease which is Sotos Syndrome. Before we get started, let's get to know the members.
Sotos syndrome is also known as cerebral gigantism. It is actually a rare condition characterized by rapid physical growth during early childhood around 2 or 3 years of life. This disease was founded by Juan Sotos during 1964 and established in 1994. The prevalence of Sotos syndrome at birth is actually 1 out of 14,000. Sotos syndrome is actually one of the most common overgrowth syndrome in the world after Wiedemann syndrome. Newborns with Sotos syndrome are usually heavier, larger and taller than other children. Their heads are unusually large, long and narrow, and also have acromegalic features and pointed chin. These characteristics can be noticed when the child is around 1 to 6 years old. They also have neurological disorders like intellectual disability, autism spectrum disorder, ADHD, obsessive and compulsion features, and also clumsiness. They can gain scoliosis, heart or kidney defects, and even seizures. Also, a small percentage of them can develop cancer. Sotos syndrome is actually caused by mutation and microdeletion.
Next up, I will explain the genetic mechanism of Sotos Syndrome. Sotos Syndrome is caused by changes in a specific gene called NSD1 gene, which stands for Nuclear Receptor Set Domain Containing Protein 1. This gene is located on chromosome 5 at position 5q35. There are two types of genetic defects involved that leads to Sotos Syndrome. The first type is point mutation, meaning that there is a change in the DNA sequence of the NSD1 gene. As a result, the protein produced by this gene is weak or faulty and cannot function properly. The second type is deletion, which is the most common cause for Sotos syndrome. For deletion, a part of chromosome 5 that contains the NSD1 gene is missing. Because of this, the NSD1 gene protein cannot be made at all. Moving on, I will explain how the gene breaks and what does an NSD1 gene actually do. Sotos syndrome occurs due to haploinsufficiency of the NSD1 gene, meaning there is only one working copy of the gene present, and it is not enough to produce a normal amount of protein. NSD1 plays a big role in codes for a protein known as histone methyltransferase. This protein helps to modify structural proteins called histones, which are responsible for organizing DNA. On top of that, an NSD1 also involved in the methylation process, whereby a molecule called methyl group is added to histones. This process plays an important role because histone methyltransferase will regulate the gene activities. Through this process as well, an NSD1 helps turn growth-related genes on and off when needed. Now, what happens when an NSD1 gene fails to function properly? When this happens, it cannot produce a functional protein. This leads to overgrowth, which is an essential part of Sotos syndrome. In addition, affected individuals may experience learning disabilities due to uncoordinated brain development, and changes in facial appearance are also commonly seen. Furthermore, is Sotos syndrome is inherited? Well, Sotos syndrome usually follows an autosomal dominant pattern, meaning only one altered gene is needed to cause the disorder. However, many cases occur due to new mutations, also known as de novo mutations. This means the condition is not inherited from the parents. To conclude, failure of an NSD1 gene affects growth, brain development, and appearance, and the condition may be inherited or occur as a new mutation.
Now, let us move on to the symptoms of Sotos syndrome.
One of the most noticeable features is the characteristic facial appearance. Individuals with Sotos syndrome often have a long and narrow face, widely spaced eyes, down slanting eyelids, a high and narrow palate, as well as a pointed chin. These features can be noticed during birth, but it becomes most apparent in childhood. In addition to facial features, developmental delay is commonly observed. These include delayed motor development, such as crawling, sitting, and walking. Coordination may also be poor, which can affect activities like riding a bicycle or playing sports. Language development is also delayed as well. Many affected children do not begin to speak until 2 to 3 years of age. Another key symptom is advanced bone age. Affected children typically experience rapid growth during early childhood, particularly between the age of 3 to 4 years, making them 2 to 3 years taller than their peers. As a result, adults with Sotos syndrome usually exceed the average height for both males and females.
Now, I'm going to explain about the diagnosis of Sotos syndrome. First, clinical observation. Doctors observe the patient's physical and developmental features. For example, overgrowth patterns such as height and head circumference above the average for age. Characteristic facial features are also noted, including a broad forehead, a long and narrow face, and a pointed chin. In addition, developmental delays or learning difficulties are commonly observed. Next, developmental assessments. These assessments evaluate cognitive function and learning abilities. Speech and motor skills evaluation are carried out to identify delays in communication and movement. Screening is also performed for associated conditions such as seizures, scoliosis, and abnormalities involving the heart or kidneys. The most important step is genetic testing. Molecular testing is conducted using a blood sample to detect mutation in the NSD1 gene, which is the most common cause of Sotos syndrome, and a deletion detection technique such as FISH or MLPA are used to identify deletion involving the NSD1 gene. Finally, imaging studies may be performed if needed. A brain MRI can reveal structural differences in the brain. If organ involvement is suspected, an echocardiogram or renal ultrasound may be conducted. In conclusion, the diagnosis of Sotos syndrome requires a comprehensive approach that combines clinical findings, developmental evaluation, genetic confirmation, and supportive imaging to ensure an accurate diagnosis.
Next, I'm going to explain about management and intervention of Sotos syndrome. There is actually no specific treatment to heal Sotos syndrome completely. What we can do is only manage the symptoms which are directed towards the specific symptoms that are apparent in each individual. Hence, it needs coordinated effort of healthcare professionals to plan the child treatment. Ongoing surveillance is key to prevent future complications. These are some of the symptomatic management, including regular follow-up, dental and eye examination, occupational, physical, and behavioral therapy. There will also be use of MRI and ultrasound. Echocardiogram is used to rule out congenital heart defects, while renal ultrasound is used to detect kidney and bladder problems. If intracranial pressure raise is suspected, they are advised to have a consultation with a neurosurgeon. Sotos syndrome cannot be prevented because it is a genetic condition. Next is the future of Sotos syndrome treatment. Here's what I found based on my researches. Firstly, epigenetic therapy. Just like what my friend explained earlier, Sotos syndrome is caused by hypomethylation that causes genes that should be turned off to be turned on. So scientists are developing epigenetic drugs to restore this chemical balance. Other than that, usage of AI to give thousands of existing medicines to find one that mimic the function of an NSD1 enzyme that regulate the gene expression.
So by combining these two, we are moving closer to a treatment that can actually improve the neurodevelopmental outcomes.